Insulin resistance and hypoglycemia are two conditions related to the body's management of blood sugar levels, which can significantly impact overall health if not managed properly. Insulin resistance occurs when the body's cells don't respond adequately to insulin, a hormone that regulates blood sugar, resulting in elevated glucose levels in the blood. On the other hand, hypoglycemia is characterized by abnormally low blood sugar levels, leading to symptoms like dizziness, sweating, confusion, and in severe cases, loss of consciousness. Treatment for these conditions includes dietary adjustments, regular exercise, medications, and in some cases, insulin therapy to help maintain stable blood sugar levels. Risk factors for insulin resistance include obesity, a sedentary lifestyle, and genetics, while risks for hypoglycemia often relate to diabetes treatment, certain medications, or underlying health conditions. Here's a detailed look at the nuanced aspects of insulin resistance and hypoglycemia, exploring their implications and management strategies. Endocrine function, insulin overproduction versus insufficient insulin response. Insulin resistance and hypoglycemia represent contrasting paradigms in glucose homeostasis and endocrine function. Insulin resistance is a state where cells in the body do not respond effectively to insulin, requiring higher levels to achieve glucose uptake, often leading to hyperglycemia and predisposing individuals to type 2 diabetes. Conversely, hypoglycemia occurs when there's an overproduction of insulin or insufficient glucose in the blood, leading to alarmingly low blood sugar levels, which can cause dizziness, confusion, and even loss of consciousness. Distinguishing between the two is crucial, as insulin resistance demands lifestyle changes and possibly medication to enhance sensitivity, whereas managing hypoglycemia involves immediate sugar intake to avert potential crises, with long-term strategies focusing on balancing insulin release and dietary habits. Glucose levels, chronic high versus acute low. When distinguishing between insulin resistance and hypoglycemia based on glucose levels, it's a game of contrasting dynamics. Insulin resistance, typical of prediabetes and type 2 diabetes, is marked by the body's inability to respond properly to insulin, often leading to chronically high blood glucose levels as cells cannot effectively take up sugar from the blood. On the flip side, hypoglycemia is an acute condition characterized by dangerously low blood glucose levels, which can happen suddenly and produce symptoms like shaking, sweating, and confusion. This can occur in people with diabetes who accidentally overdose on insulin or miss meals, or in non-diabetic individuals with various metabolic dysfunctions. Understanding blood glucose trends is critical for diagnosis and management, as chronic hyperglycemia damages organs over time, while acute hypoglycemia poses an immediate risk of seizures, unconsciousness, or even death if not swiftly addressed. Symptom onset, gradual versus rapid. Insulin resistance and hypoglycemia, while interconnected, present with contrasting symptom profiles regarding onset and progression. Insulin resistance, a condition where cells in the body become less sensitive to insulin, resulting in elevated blood glucose levels over time, often has a gradual, insidious onset. Individuals may remain asymptomatic initially or experience subtle signs such as fatigue or weight gain. Conversely, hypoglycemia, characterized by abnormally low blood sugar levels, triggers a rapid onset of symptoms due to the acute shortage of glucose in the brain. Symptoms include shakiness, sweating, irritability, confusion, and even loss of consciousness, demanding swift intervention. Recognizing the nature and tempo of symptom onset is crucial in differentiating between these conditions. Primary risk factors: obesity and sedentary lifestyle versus medication and illness. Insulin resistance and hypoglycemia are closely linked to the body's ability to manage blood sugar levels. Obesity and a sedentary lifestyle significantly increase the risk of insulin resistance, wherein cells fail to respond effectively to insulin, leading to elevated blood glucose levels. This condition is a precursor to type 2 diabetes and is often a consequence of excess body fat and physical inactivity, which impede the effective functioning of insulin. Conversely, hypoglycemia, characterized by unusually low blood sugar levels, can be triggered by certain medications or illnesses. It results in a rapid depletion of glucose, which is essential for brain function and overall energy, causing symptoms like shakiness, confusion, and in severe cases, unconsciousness. Strategies to mitigate these risks involve weight management, exercise, and careful monitoring of medication, illustrating the importance of lifestyle choices and medical oversight in preventing and managing these conditions. Management approach: lifestyle changes versus immediate glucose intake. When managing insulin resistance, lifestyle changes are typically the primary approach. This includes adopting a diet rich in whole foods, regular exercise, and weight loss, which can improve the body's sensitivity to insulin. Consistent physical activity can particularly help muscle cells become more receptive to insulin, allowing for better glucose usage. On the other hand, hypoglycemia, a condition characterized by abnormally low blood sugar levels, often requires immediate action through glucose intake. Consuming fast-acting carbohydrates such as fruit juice, candy, or glucose tablets can quickly raise blood sugar levels to safer levels. While lifestyle modifications can contribute to preventing hypoglycemic episodes, acute management relies on timely glucose administration.